Okay, so I think we're going to get started here. Hopefully everybody's on. Can everybody hear me, or is anyone having problems hearing me? I can't see anybody, so I guess I won't get feedback if you can't hear me. All right. I can see Fort Capel. Fort Capel, can you hear me?
Yes, we can hear you. Sorry, we're on mute.
Okay, sounds good. All right. Okay, well, I'll get started then. In the meantime, can I get everyone else just to mute their line, and then you can unmute them later on for questions, just because I'm getting a little bit of feedback here. Perfect, thank you. Okay, so my name is Mike Stuber. I'm a pharmacist here in Regina, working with the HIV team, and I'm part of the HIV Collaborative. So thanks everybody for coming in today and giving up your lunch hour to listen to me talk. Just going to hopefully won't take very much time, but we're going to talk about antiretrovirals and coverage, because it seems to be a bit of a problem overall, trying to make sure that people can afford their medications. And there's been some key updates in the last little bit. So I'm going to talk a bit about drug coverage in general, the process for people who might not be familiar with it, the changes that have been made, and what that means for anybody who's involved with anybody who has HIV or on antiretrovirals, and some of the ways to ensure that people can get the medications in an affordable fashion. We're also going to talk a little bit about PrEP and what the coverage changes mean for that, and then just maybe give a brief update on some of the new things that are coming, and where they stand for new medications. Okay, so as far as disclosures, I've gotten some fees from some other companies, but if there's any bias in this, please let me know. So first, we're just going to talk about drug coverage in Saskatchewan and what that means. So I think there's a lot of misconceptions around what drug costs are and how that price that's at the pharmacy, how that gets created and what goes into that. Okay, so I'm going to start back at the basics. This was a bit of a learning experience for myself as well. So we're going to go through it, and if anybody from the drug plan is on and I mess this up horribly, please let me know. So there's three components to a drug cost, or for a drug price. And the first one, of course, is the drug cost itself. And that's what the actual medication itself costs to the pharmacy. So that cost, there's a lot of things that go into that, but overall it comes from the Pan-Canadian Pharmaceutical Alliance, or the PCPA. And they're kind of like the pricing group in Canada that sets the price for brand name medications. And then individual provinces negotiate those costs on their own as well. But it's kind of just to help with buying power. So that's what the pharmacy will pay to the wholesaler. So when they order that drug into the pharmacy, that's what it costs them out of pocket. Okay. Markup is essentially what it is. It's the markup. So it's what they can make off of that drug when they dispense it. So it's a percentage of the drug cost. It's a tiered based percentage, kind of like a bracket. So depending on the base cost of the medication, there's different percentages that pharmacy can charge on that. So the maximum that a pharmacy can charge per prescription is $20. Okay, so that any drugs over $200, that's that highest bracket, and they can make $20 off of for markup off that drug. Keep in mind that most antiretrovirals cost much more than $200, so pharmacies are only making about $20 off that prescription on markup. And there's the professional fee, which was formerly called the dispensing fee. So that covers pretty much everything the pharmacy does, including dispensing, the counseling, the professional services, all the drug information they give out, drug interaction check, everything that a pharmacist does. And that's a maximum of $11.40 per prescription. Okay, so that drug price that gets submitted to the drug plan includes the drug cost itself, the markup, and the professional fee. So that total cost is what gets submitted to drug plans for payment. Drug plans will receive that total cost, generally online, so it's a pretty quick thing behind the scenes in the pharmacy, and that they may, depending on what each individual drug plan has for their plan, they may pay that whole amount, or they may pay a partial amount of that of that cost based on a specific formula that they have. So it's different between every drug plan. It might be a percent of the drug cost. So people may be on the hook for 10% of the drug cost, or it might be a max allowable cost as well. Whatever isn't picked up by that first payer or their sequence of drug plans that they may be involved in, that gets passed on to the next payer or the patient as a copay. So whatever's left over is called a copay. So I'm just going to be talking pretty much about drug coverage in general. So, and we'll talk about antiretrovirals in respect to that afterwards. So antiretrovirals are not listed separately like they are in certain other provinces. They're just listed just like any other medication, like your statin or your blood pressure medication or whatever. So they're listed on formularies and they're covered under all those same programs with a little asterisk because there's some updates, and that's kind of what this whole thing's going to be about. In Saskatchewan, there's two primary payers that work in two different streams. So there's the non-insured health benefits, or NHB, and Saskatchewan Drug Plan. That should cover the bulk of patients, and those are the two primary payers. People who are not covered under one of those programs will be covered under things like workers' comp or other federal programs like Interim Federal Health Program for Refugees or Canadian Forces, RCMP.
Got it.
Can I get somebody to mute your line, please? Thank you. Knowing your patients, sorry, there's just somebody on the line who hasn't muted it. It's quite loud in here. Okay. Knowing who your patient's insurance provider is critical to ensuring that medication access. So we'll talk about NHB first, and that's a federally administered program through the Department of Indigenous Services Canada, and that's for all eligible First Nations or recognized Inuit people. Those patients will all have a number, either known as the treaty number or the DIAND, and that's their billing number, just like you'd have a Saskatchewan health card. That's the number that they would use for health coverage. Not everybody will know that number, but if they have one and you're not sure what that number is when you're billing, that can be found on eHealth under the patient demographics. So it's available and it can be found there. Coverage should be automatic and it doesn't expire if the patient moves provinces because it's a federal program. Although the formularies might be a little bit different from province to province. Medications covered under NHB are listed on the DBL, which is their formulary. And although they generally tend to mimic the provinces okay, it's not 100%. So some things may be covered on NHB that are not covered on SAS drug plan. Okay. Anything that's listed on that drug benefit list formulary from NHB means that it's fully covered for patients with that coverage. So patients with that coverage don't pay out of pocket for any medication, and it's 100% coverage. So that prescription should not cost that patient anything. There's a separate list or a separate process for things not on that list called prior approval, and certain drugs may be eligible for coverage kind of in the way that EDS works for SAS drug plan. So one of the drugs of interest is probably Descovy right now. So although it's not listed on the drug benefit list, it could be eligible with prior approval. The other one is Saskatchewan drug plan, and that's provincially, and that is for anybody in Saskatchewan with a valid Sask health card who does not have a treaty number. So patients without an active health card can't receive drug plan benefits with a few caveats, but it's linked to your health card. So people need a health card to get drug benefits in Saskatchewan. Patients who move to Saskatchewan who want drug coverage need a health card as soon as possible. If you move to Saskatchewan and you want drug coverage, benefits will begin on the first day of the third month following the date that you establish residency. So it takes about 3 months after you get here before benefits kick in. And similarly, when you leave, your benefits will expire on the last day of the third month that you leave Saskatchewan. So it's tied to your residency, and that's pretty similar across the country. So you don't necessarily get drug coverage the day you get to a new province. People who may not live here full time can still get benefits. So as long as you maintain a residence in Saskatchewan and live here for 5 months a year, you can maintain benefits. Outside of those things, permanent residents. So you don't have to be a Saskatchewan or a Canadian citizen or resident, but permanent residents, landed immigrants, people who have been discharged from the Canadian Forces, people who are here for on visas with their trade or profession, international students, and spouses of returning Canadian citizens are eligible for coverage. Students who move around the country who are Canadian citizens should keep residency or keep their benefits of their home province. But international students, so people who may come to Saskatchewan from other countries, they'll be eligible for Saskatchewan health benefits. So Saskatchewan health plan is a little bit more complicated than NHB. It's not across the board 100% for drugs. It takes into account your drug costs, your income, and then that ratio. So if your drug costs exceed a certain percent of your income, benefits may kick in. Your age, so we have different cutoffs. Different conditions have different coverage, and how urgent that is. So there's a few paths to get emergency coverage if need be. So our drug plan formulary is listed online at that link below, so you can see which medications are eligible for coverage. Just remember that eligible coverage doesn't mean that it's 100% coverage, because that's not the case for medications under this program. Drugs that are not listed on that formulary may be covered under exceptional drug status. So that's a case-by-case basis where drugs have to meet particular criteria. So it just puts a few more barriers to make sure that those drugs are being used in the way that they're approved. And again, that does not mean 100% coverage if you have EDS. It just adds it to that drug plan formulary, and you'd be covered under whatever plan you normally would be for your other medications. High-cost drugs, so formerly HIV medications, were available through the Special Support Program, and that requires documentation of your income. So for patients who don't file their income tax on a regular basis, will be cut off that program because the government needs to see a proof of income to determine what your ratio or your what to determine a cost that you'd pay out of pocket. People on social assistance, they get benefits through that program, and that's $2 per prescription, up to a maximum of $10. So anything 5 or more prescriptions equals a zero cost. Okay, so there's a bunch of other programs kind of throughout the drug plan, and it can be pretty complicated. There's no one way to say what somebody's going to pay out of pocket through the Saskatchewan drug plan. Very few people in Saskatchewan get their medications covered 100% under this program. And as I said, we generally can't tell you what your copay is going to be before we run it through the drug plan at the pharmacy. After it goes through that plan, the third-party drug plan, so what people might have through work or a private drug plan like Blue Cross or Great West Life, those things may pick up the remainder of the cost or another percentage of the cost, and they can either pay 100% or they can give a copay to their beneficiaries as well, depending on that plan. So everybody's plan is different. Everyone's policy is a little bit different. It makes it pretty complicated. So those are the two main primary payers in Saskatchewan. So we have two programs. Making sure that you know which program your patient is covered under is really essential. People under NHB do not pay out of pocket for medications listed. Patients under SaskHealth pay based on the drug cost and income ratio, and really requires a proof of income and residency. For HIV medications in the past, even though all these programs were there, because of the cost of medications, the SAS drug plan historically had paid quite a bit anyway, so most people didn't pay full price for their HIV medications, but likely still paid a little bit of that copay. So hopefully that cleared everything up, and we'll talk about the changes that came through. So talk about the recent changes. Nothing has changed with NHB. It's still a really good program. All those medications that are covered under the drug plan or the drug benefit list, 100%. So people still continue to pay nothing out of pocket for that if they are eligible under NHB. The big change here is in April, when the budget came out this year, the government made a commitment to expand universal drug coverage for antiretrovirals. So that was a $700,000 budget increase. And what that means now is there's no difference between the two programs. So eligible antiretrovirals are provided to patients at no cost. So again, if it's listed on the formulary, patients should not pay out of pocket for any antiretroviral medications. So we don't have to apply for special support anymore, which was a big barrier to getting people on medication in a timely manner. And it doesn't really matter if people maintain their income tax on a regular basis or can submit proof of income. So changes in income, if you lose your job or you get a new job with a higher wage, that doesn't change how much you pay out of pocket anymore. Everything is just a flat 100% coverage. Which is really good because we had a lot of people struggling to pay for their medications based on their affordability at the time. So this is kind of exciting. It's a big thing. Saskatchewan is now the third province in Canada after BC and Alberta to provide universal coverage of antiretrovirals. So it's a big significant change that is going to make things a lot easier for patients on this program, but also for healthcare professionals working to provide that care. Really, this is probably just a selfish slide. It's less work on my end, so I'm happy about that. So what still needs to happen? It doesn't mean that everything's free and you can just go and get a year's supply and not pay anything. It still goes through the drug plan. You still need a valid health card. So again, it's really important to remember that coverage begins 3 months after you establish residency. So if you know somebody who's moved to Saskatchewan who has HIV or any other chronic medication, the number one step right away is apply for a health card. And there's a link online. It's a pretty easy process. And whatever province you come from, try to tell people when you move here, bring 3 months supply from home because you're not getting anything covered here in Saskatchewan. We generally, depending where you come from, we can't bill those provinces either, so you can't fill them at a pharmacy here and bill home. It's easiest if you just get them couriered from a home pharmacy. Drugs still must be listed on the formulary, so not all antiretrovirals are 100% covered. Things that aren't on the formulary are not covered, obviously, and you still need EDS for certain drugs. If you meet EDS criteria, then 100% coverage kicks in. There are certain drugs that don't even have EDS criteria yet, so those are generally newer medications. As I mentioned, Descovy, has prior approval availability through NHB. That's not an option under Sask Health. So things like that, they're not even listed at all, and they're not covered by the drug plan. So there's certain ways to get around that. So for people who need to be on a medication such as that, there are support cards through the manufacturer, and that's right now for that. That's the only drug that kind of exists in that area right now. But it comes and goes as new medications come on the market, and pharma can make that choice of what they're going to support or not. So this is the big question: does this cover PrEP? And yeah, so we use Truvada or generic Truvada right now. TDF-FTC is PrEP. It's an antiretroviral. It's 100% covered for all antiretrovirals. So this makes Saskatchewan the second province to give 100% coverage to PrEP after BC. So we're doing pretty good on that front. And I know that this has been a big issue with people who want PrEP and haven't maybe heard this news yet. That PrEP is now cheaper. It was added to the formulary on January 1st. So it was paid for by that program. But now it's 100% through both NHB and Saskatchewan Health. So if anybody has been talking with people about PrEP and they're worried about the cost, you can let them know that no, it should be covered 100% and should not cost them anything out of pocket. Just speaking about PrEP, I'll give a little plug for our PrEP clinic here in Regina. Anybody who is in the southern Saskatchewan area who needs PrEP or wants to learn more about PrEP, you can give us a call at 306-766-3935. We're based out of the Hamilton Street Sexual Health Clinic. Saskatoon, I know that Out Saskatoon had just started their PrEP clinic, I think last weekend. And I'm not sure what their schedule is going to look like yet, but you can give them a call at 306-665-1224. And I believe PLP, or the Positive Living Program, also sees people for PrEP, but I think that is still on a referral basis. But you can give them a call and get booked in too for people in Saskatoon. So it's a great program. These are really good changes, but of course, nothing is wonderfully perfect, and there's always a few problems. So we'll just talk about a few of the things that may come up. So the big thing that we're still seeing occasionally is when people have to pay for something out of pocket. The big question there is, what product are you being asked to pay for? Is it for your opportunistic prophylaxis? So people who need Septra or azithromycin for PCP or MAC prophylaxis, those things aren't covered. They're still antibiotics. They're not terribly expensive, and they'll still be covered under the regular program. But if people are expecting to pay nothing for their medications, they might be just a little bit surprised to see that they have to pay for this when out of pocket. So they'll still have to continue to pay for that. Any other medications that person is on, they'll still pay for. So just having HIV doesn't mean all your drugs are free, just your HIV medications are. So your statins, your blood pressure medications, your diabetes medications, those still fall under all your other plans, whatever those may be. The other big question is, what drug products is the pharmacy using? So the big one that I've come up across is people using the brand name product for PrEP especially. So sending that prescription off that says Truvada, and they want to use the brand name, and the brand name is much more expensive than the generic. That's not going to be covered by the drug plan. So make sure that they're using the least cost alternative. The other one, as I mentioned before, drugs not on formulary or not on EDS. So as I said, Descovy for now, that's my big example because it's the only one that we're kind of waiting for. Not covered by SBDP at all, not even by EDS. We can potentially get through NIHB with prior approval, but it's not 100% either, so it depends on the criteria that you need for that patient. Make sure that paperwork is filled out if you want NHB to cover it, and that pharmacy knows to apply for the product, because they may not be aware of that, depending on their familiarity with HIV medications. If need be, a third-party support card can work for that. So that could be the manufacturer support card, if there's a program like that through the pharma company, or some people's private insurance may still cover things like that. So depending on your individual private drug plan, we could probably run it through and see if your drug plan will pay for that. The other one where people may get an error at the pharmacy and be asked to pay out of pocket is for a fill too soon. So you can't fill, a month's supply every couple days. There's limits around how much your drug plan will pay for that. SaskHealth allows 3 fills in 45 days. So that can kind of help you, do your planning around people who need to travel if you're going out of town, or if you're, going down south for the winter or whatever. As long as you maintain your residency, you can do that, but you need to, creatively fill that and work that with your pharmacy to make sure that you can get your drugs covered in a timely manner. NHB has their own criteria around early fills. There's usually codes for lost and stolen medication, so it shouldn't be a barrier, but sometimes it takes a little bit of work on the pharmacy part to make sure that those things are put into place. And the other one is the patient doesn't have Saskatchewan health benefits. So we have a few people who have moved here who may not have been aware that they need to apply for a health card. Lots of people don't think about that until it's kind of too late. So making sure that those patients have a valid health card. If they don't, do they still have benefits back in their home province, and potentially we can get something brought in to bridge that gap. But really, the best thing for people to do is to apply for a Saskatchewan health card online. And that process isn't too complicated, but some people may need assistance with doing that. If there's another problem here that's not listed, I don't mind taking phone calls, and we can work around everything. So you can either send me an email if you have specific questions, or give me a phone call, 306-766-0717, and I'll get back to you, and we can make sure that people get medications at no cost. I'm just burning through this, so we should be out of here pretty quick. So that's pretty much it for the update on medications, and we'll have lots of time for questions here at the end. So I just want to talk a little bit about new medications, so what's coming on the market and what's still yet to come. So pretty much generics is the moral of the story here in the last little while. So HIV drugs are, they've historically been very high cost, all been brand name, very expensive. In the last few years, we're starting to see patents run out and a lot of generic companies picking up on that and producing low-cost alternatives. So things that people may not be aware of, but a lot of the drugs that we have used historically, they're great now for low-cost alternatives. So Truvada is the big one that we use for treatment, but also for PrEP. Went generic last summer. So that drug cost came down from about $900 and some per month to about $260 per month. So that's that raw drug cost. Kyvex is kind of the alternative to Truvada. That one's also generic. Cystiva and Atripla both went generic, and Reataz, which is the protease inhibitor, and Comavir. Those are generic. There's more generics as well, but these are ones that potentially could be used for people, if we're trying to minimize drug costs. So people who may not have Saskatchewan health benefits but are willing to pay a bit, we can generally pull some regimens together with these generic regimens and make something a little bit lower cost and affordable. So the big thing with generics is that obviously they're cheaper. Everybody knows that. But Sask Health will cover the least expensive interchangeable drug product. So now that antiretrovirals are covered 100%, they're only paying that to the max allowable cost. So if somebody wants brand name Truvada, which is still $900 and some bucks, they're going to pay the difference between that and the generic cost. So making sure that we use that lowest cost generic. And that applies for pretty much all medications listed in Sask Health, whether it's HIV drugs or not. But if somebody wants a different product that's not available, they may have to pay out of pocket for that. All right, and then for updates on coverage, so I've talked about Descovy a bit, just because we've been using it for quite a while now, over a year or so. We're still waiting for coverage through Pan-Canadian. So it's not available through Sask Health, and as I said, there's no EDS criteria, but we can get that through prior approval. It just kind of takes some making sure you're listing why you want to use that over the alternative. And as I said, there's manufacturer support cards available, depending on what the drug company wants to do with that at this point. Some exciting new things that are coming out. Juluca is a new single tablet regimen from ViiV, and it's kind of exciting because it's the first 2-drug single tablet regimen. So traditionally, HIV therapies all included 2 NRTIs plus a third agent. Juluca is the first commercially available single tablet regimen that includes no NRTIs and has an integrase inhibitor and an NNRTI. So dolutegravir, rilpivirine. It's a tiny little tablet, and as I said, it's nuke sparing, so no nucleoside reverse transcriptase inhibitors. I forgot to put that on here, but it's only for switch, so we can't start people on this medication for a new HIV infection. But if somebody's been suppressed for a while on their medication, this would be a good alternative for them potentially. It's Health Canada approved, so it's safe to use in Canada. We can use it, but no public drug plans are paying for it at this point. We're eagerly awaiting a few third-party coverage cards, though. So potentially for the people who really need this drug, we should be seeing some cards available soon. Another new product that's coming out is kind of a repackaging of an older medication, Icentris or raltegravir. Raltegravir has traditionally been 2 tablets, so 1 tablet taken twice a day. So Merck came out with their high-dose Icentris, which is a 600 milligram tablet. So you take 2 of those once daily instead of the twice-a-day dosing. So a little bit easier for people who maybe have problems taking medications twice a day. The twice-a-day dosing still is recommended for pregnancy, though. So we can't use the single tablet or the single dose for pregnant women. Although it is a good alternative potentially for women who want to become pregnant, just with some changes that came out recently with dolutegravir maybe not being the safest medication for women who want to become pregnant. So Icentris might be a good backup for women in that case. So although this has been approved in Canada, we're waiting for coverage in Saskatchewan. Merck has decided not to support this medication in Saskatchewan, so we don't have access to it here. Particular private plans may pay for this medication, and that could be checked with an individual's their own policy. So if they want to call their drug plan and see if their private drug plan, see if it will cover it. That could be an option. But unfortunately, we don't have widespread access to this, like some of the other provinces do, where Merck has chosen to support that product. Biktarvy is kind of it's not approved in Canada yet. It just was approved by the FDA earlier this year, and we're waiting for Health Canada approval. And then down the line, we'll be waiting for reimbursement. So it's a little bit of a longer process to get to Biktarvy access. But this is a new integrase inhibitor called bictegravir, very similar to dolutegravir with a little bit of a different side effect profile. But that's packaged with emtricitabine and the new tenofovir alafenamide put out by Gilead. So it's a small single tablet regimen. It's kind of their alternative to Genvoya, which was a boosted regimen. So we take out that booster medication, which might be a good single tablet regimen alternative to the very popular Tivicay-Descovy regimen that a lot of people in Saskatchewan have been using. So again, not available, but it's on the horizon, and we'll see where that kind of fits in down the line. And then a new drug itself that's being developed by Merck called dorovirine. Not yet approved in Canada, but it's likely to be marketed both as a standalone, so we can pair it with whatever we want, or as a single tablet regimen with kind of the older TDF-FTC, or actually I think it might be TDF-3TC. My apologies, I'd have to double check that. So it should be a lower cost single tablet regimen. But what's kind of cool about dorovirine is the first NNRTI to be put out in quite some time. So that kind of an older class that hasn't seen much attention or research lately, but it's the first NNRTI to come out since rilpivirine. It looks pretty good. It's kind of going back to an older class, but I think there's probably a place where it can fit in the landscape in the future. Another new product that's come out is Simtuza, which is put out by Janssen. And that's kind of a combination of Descovy and Prescovix all pushed into one tablet. So darunavir, cobicistat, FTC, and TAF. Janssen really hasn't been marketing this one much, and we don't have access cards. So it's been approved, but it's not covered by any provincial formulary. Kind of the trend has been to move away from protease inhibitors in general. So I'm not sure exactly where this one's going to fit into the market, but it is available out there for the rare person who may have private coverage and thinks this might be a good option for that person. Okay. And future pipelines, like there's still lots of really interesting medications coming out on the horizon. We're really looking forward to some more 2-drug regimens that are coming out. So Juluca is kind of the first one, but we'll be seeing more non-NRTI regimens. Long-acting injectables are kind of in trial, and they're working towards getting those to market in the probably not too distant future. There's some new medications that kind of mimic NRTIs, but work in a little bit of a different way. So lots of different research, kind of even in the older classes, some new fresh molecules coming out that way, as well as new classes coming out that are being developed. So lots of interesting things that will be coming out in the future, and things continue to change. So I'll summarize this quickly, and I realize I missed a few things, so maybe I'll just talk about those as well, about some of the criteria for antiretrovirals. But so one of the things I missed was I talked about antiretrovirals being eligible antiretrovirals. So as I said, those are medications that are listed on the SAS drug plan or the NHB formulary. One of the other criteria that makes them eligible in Saskatchewan under the SAS drug plan right now is that they have to be prescribed by a infectious disease specialist or approved prescriber. So not everybody can initiate antiretroviral therapy. They'd have to be seen by ID or somebody who's on an approved list for that initial prescription for an antiretroviral. So that list is I don't think it's available online, to be quite honest, but prescribers who want to be on it can ask to be added to that list. And then should they write that prescription, it should be automatically covered through the SAS drug plan. Repeat prescriptions or things that have been renewed, those can be done by anybody with prescribing authority. So that can be done through a family physician who's not on that list, nurse practitioner, pharmacists who can prescribe, or renewed by pharmacists for prescriptive authority. So it should never be a barrier that you need to see an ID specialist to get your medication renewed. Although we still encourage people to check in with their primary provider or an ID specialist or somebody on that list on a regular basis, just because as we just demonstrated, there's a lot of new medications coming out. So we want to make sure that people get offered new medications that might be better for them, or safer, or just a better option. And as well as make sure that all the appropriate monitoring is being done, such as viral load and CD4 count, and just checking that the medications are safe. So I think we're still kind of tweaking around with that at the drug plan. The ministry are looking into what that list is going to look like. But for now, just make sure that if there's a drug cost problem, potentially it could be that it was prescribed by somebody not on that list. So that's one of those other sort of troubleshooting things. So just to summarize, I guess, here, antiretroviral medications, including PrEP, are now fully covered for everyone, regardless of whether you're covered under SaskHealth or under NHB. So it doesn't matter what program you're on, you shouldn't have to pay out of pocket for antiretroviral medications. And that, again, that doesn't apply to only people with HIV. As I said, it's PrEP too. So make sure that people are aware that PrEP should be no cost to people as well. Again, those criteria still apply, and the drug plan itself, we still have to go through the right steps to make sure that people have coverage under both programs. If there's anything that you're not familiar with, or you're having trouble finding what the root of the problem is, please don't hesitate to give me a call, and I'll try to get back to you as soon as possible, and we'll work through the problem, and we'll get people on coverage. And I think that's it. It was a pretty quick talk today. So questions, you can unmute your line and ask away. Is there any questions out there at all? Awesome. Okay. Well, thank you very much. Again, you can give me an email or give me a call if something ever comes up. Or again, you're just looking for ways to get people covered. Don't hesitate to give me a shout. Okay. Thanks.